What if the tiny white tablets you trust every day are silently stealing your strength, your memory, even your independence? The truth is scarier than you think, and it's hiding right in your medicine cabinet. I'm a physician who has spent decades watching seniors navigate the world of prescriptions, and I've seen how a simple pill can become a hidden threat. Many people over 60 take medicines daily without knowing the side effects that can appear later in life. I'm not telling anyone to stop their medication without a doctor's guidance, but I am urging you to become informed and make smarter choices. In the next minutes, we'll uncover 5 everyday drugs that could be a silent danger, learn how to spot warning signs, and discover simple steps to protect your health while keeping your independence. Let's start with the first culprit that most of us never suspect. You might think a simple ibuprofen can't hurt you, but for seniors, it can be a ticking time bomb. These painkillers are used to relieve headaches, joint pain, and arthritis. After 60, the kidneys and stomach lining become more fragile, and the drug can irritate the lining and reduce blood flow to the kidneys. The possible effects include stomach ulcers, bleeding, higher blood pressure, and even kidney failure. You need to be extra careful if you already have high blood pressure, kidney disease, or take blood thinners. Imagine a man named Juan, 68, who takes a tablet every night for his knee pain. After months, he starts feeling a dull ache in his stomach and a slight swelling in his ankles. His kidneys are sending a distress signal. This is something that almost nobody tells you, and it could be affecting you without you noticing. Now let's move to a second drug that many keep at the bedside. A night's rest can turn into a day's nightmare when the sleeping aid stays in your system longer than you think. These pills help with insomnia, anxiety, and muscle relaxation. But after 60, the body's metabolism slows and the medication lingers, affecting balance and cognition. The side effects can be lingering drowsiness, falls, memory lapses, and even dependence. If you live alone, use a walker, or have a history of falls, you must be especially cautious. Take Maria, 72, who takes a tiny pill before bed. By morning, she feels foggy, trips over her slippers, and forgets where she placed her glasses. That fog isn't just a bad night's sleep, it's a warning sign that the medication is still acting on her brain. Here's where it gets even more eye-opening. Many seniors rely on blood pressure medicines to keep their heart safe, but not all of them are created equal for an older body. These drugs are prescribed to lower blood pressure and prevent strokes, yet after 60, the vessels become less elastic, and some of these medicines can cause an abrupt drop in pressure, leading to dizziness, fainting, and falls. The risk grows if you combine them with diuretics or certain painkillers. Picture Elena, 65, who feels lightheaded every time she stands up to get a glass of water. Her heart is trying to keep up, but the medication is pulling the rug from under her. That sudden dizziness is a red flag you shouldn't ignore. The fourth medication often slipped into daily routines is the cholesterol-lowering statin. It's meant to reduce heart attacks, but in older adults, it can sometimes cause muscle pain, weakness, and even liver issues. The body's ability to process these drugs changes with age, making side effects more common. If you notice unexplained fatigue, muscle cramps, or a yellowish tint to your skin, it could be a sign that the statin is doing more harm than good. Think of Carlos, 67, who suddenly finds it hard to climb the stairs to his garden. He chalks it up to age, but the real culprit might be the medication he's been taking for years. Finally, let's talk about antacids and acid-suppressing drugs that many seniors use to ease heartburn. They're useful for short-term relief, but long-term use after 60 can interfere with the absorption of vital nutrients like calcium and vitamin B12. This can lead to weaker bones, increased fracture risk, and even memory problems. If you've been popping these pills for months and notice you're getting more bruises or feeling a bit foggy, it's worth investigating. A simple change in diet or a short trial off the medication under a doctor's watch can make a big difference. Now that we've uncovered how these common pills can become silent threats, I want to hear from you. What experiences have you had with any of these medications? Share your thoughts in the comments. I really want to know your perspective. The key takeaway is that knowledge is your best defense. Always talk to your doctor before making any changes and ask if there are alternative treatments or lifestyle habits that could reduce the need for a particular drug. Simple habits like regular gentle exercise, balanced nutrition, and staying hydrated can often lessen reliance on painkillers or sleep aids. Keep an eye out for warning signs such as unexplained stomach pain, sudden dizziness, persistent fatigue, muscle weakness, or any new memory lapses. If you notice any of these, schedule a checkup and discuss them openly. Remember, caring for your health is the most powerful way to preserve your independence and enjoy the years ahead. If this is opening your eyes, hit that subscribe button and let's keep exploring together. A simple change in diet or a short trial off the medication under a doctor's watch can make a big difference. Now let's keep uncovering the medicines that many seniors keep on their nightstand, often without realizing the hidden price they may be paying. The next culprit is a drug class that many people hear about at every checkup, but rarely question once it's prescribed. Statins are the cholesterol-lowering tablets that promise to keep the heart healthy. You might think they are harmless because they have been called the miracle pills for heart disease. The problem is that after 60, the body's ability to process these compounds slows down and the liver can become overburdened.
When the liver struggles, the statin can start to affect muscle tissue, leading to a condition called myopathy, where muscles feel weak, achy, or even painful without any obvious injury.
In severe cases, muscle breakdown can release substances into the blood that threaten kidney function. Imagine a grandparent who loves gardening, who suddenly finds it hard to lift a watering can or climb the steps to the porch. What they may attribute to age could actually be a silent side effect of their cholesterol pill. If you have a history of liver disease or you notice unexplained muscle soreness after starting a new statin, it is essential to bring this up with your physician right away. A simple blood test can reveal whether the medication is causing trouble, and sometimes a lower dose or a different type of cholesterol-lowering strategy can keep both the heart and the muscles happy. Moving on, let's talk about a group of medicines that many seniors reach for when they experience that burning sensation after a big meal. Proton pump inhibitors, often called acid-suppressing drugs, are marketed as a quick fix for heartburn and ulcer pain. For a short spell, they work wonders, but using them for many months or years can interfere with the absorption of vital minerals such as calcium, magnesium, and vitamin B12. When the body can't absorb enough calcium, the bones become more fragile, raising the risk of fractures from simple falls. A deficiency in vitamin B12 can lead to fatigue, tingling in the hands and feet, and even memory lapses that mimic early dementia. Consider Rosa, who has been taking an acid suppressor for a decade to ease her reflux. She recently slipped on a garden step and bruised her wrist, and she's been feeling unusually forgetful about where she puts her keys. These signs could be the body's way of saying that the medicine is stealing nutrients and needs to stay strong. If you rely on these pills daily, talk to your doctor about whether a step-down plan, dietary adjustments, or a short trial without the drug might restore your nutrient balance. Now, let's shift our focus to the medication that sits in many medicine cabinets under the label blood pressure. Angiotensin-converting enzyme inhibitors, commonly called ACE inhibitors, are prescribed to keep blood pressure in a safe zone and protect the kidneys. While they are life-saving for many, after 60, the risk of a side effect called hyperkalemia, an excess of potassium in the blood, rises. High potassium can cause muscle weakness, irregular heartbeats, and in extreme cases, cardiac arrest. A typical warning sign is a feeling of tingling around the mouth or a sudden sense of fatigue that doesn't improve with rest. If you are also taking a potassium-rich diet, salt substitutes, or other medications that raise potassium levels, the combination can become dangerous. A regular blood test to monitor potassium and kidney function can catch problems before they become emergencies. Remember, the goal is not to abandon the blood pressure pill, but to ensure the dose is right and that you are not unintentionally stacking potassium sources. Another class that often flies under the radar is the antidepressants that many seniors start after a loss, a chronic illness, or simply to lift a low mood. Selective serotonin reuptake inhibitors, or SSRIs, are praised for their safety compared to older antidepressants, but they still carry risks for older adults. One of the most concerning issues is that SSRIs can interfere with platelet function, making bruising and bleeding more likely, especially in the gastrointestinal tract. If you notice that small cuts take longer to stop bleeding or you develop black stools, it might be a sign that the medication is affecting your clotting ability. Additionally, some SSRIs can increase the level of sodium in the blood, leading to a condition called hyponatremia, which manifests as confusion, headaches, and even seizures. A simple blood test can detect low sodium early, and a dosage adjustment or a switch to a different class of mood stabilizer may be the safer route. If you have a history of bleeding disorders or you are on blood thinners for atrial fibrillation or a heart valve, the combination with an SSRI deserves careful monitoring. Let's not forget the antihistamines that many seniors reach for to combat allergies, runny noses, or occasional itching. Over-the-counter antihistamines like diphenhydramine are often marketed as sleep aids because of their sedating properties. While they may help you drift off at night, they also cross the blood-brain barrier more readily in older adults, leading to prolonged drowsiness, confusion, and an increased risk of falls. One particularly worrisome effect is anticholinergic burden, where the drug blocks a neurotransmitter called acetylcholine, which is vital for memory and cognition. Long-term use of these drugs has been linked to accelerated cognitive decline, sometimes mimicking early Alzheimer's disease. If you find yourself reaching for an antihistamine more than a few times a week, or if you notice that you're forgetting appointments or misplacing items more often, it may be time to explore non-sedating alternatives such as nasal sprays, eye drops, or lifestyle changes like using an air purifier. Finally, let's talk about diuretics, the water pills that help the body get rid of excess fluid and lower blood pressure. These are especially common in seniors with heart failure or swelling in the legs. While they do a great job at reducing fluid overload, they can also deplete essential electrolytes like potassium and magnesium, leading to muscle cramps, weakness, and irregular heart rhythms. A sign that a diuretic is taking too much of a toll is waking up in the middle of the night to use the bathroom only to feel dizzy or lightheaded when you stand up. If you notice that you're becoming more forgetful about taking your other medicines, or you develop a persistent dry mouth, it could be a clue that the diuretic is affecting your overall balance. Regular monitoring of blood electrolytes, staying hydrated with water rather than sugary drinks, and adjusting the timing of the dose, perhaps taking it earlier in the day, can help mitigate these side effects. Now that we have walked through the 5 most common hidden hazards, pain relievers, sleep aids, cholesterol tablets, acid suppressors, blood pressure medications, mood stabilizers, antihistamines, and diuretics, let's pause and reflect on what this means for your daily life. The truth is that each of these pills can be a double-edged sword. They offer relief, but they also carry a silent risk that grows with age. What matters most is awareness.
When you understand the why behind each warning sign, you become an active participant in your own health, rather than a passive recipient of prescriptions.
Here are the most important steps you can take right now. First, schedule a medication review with your doctor or pharmacist at least once a year. Bring a list of every pill, supplement, and over-the-counter product you take, even the tiny vitamins you keep in the kitchen drawer. Ask specific questions. Is this the only drug that can treat my condition? What are the common side effects for someone my age? Do I need regular blood tests to monitor how this is affecting my liver, kidneys, or electrolytes? Second, explore lifestyle habits that can reduce the need for medication. Gentle daily movement, like a short walk, chair yoga, or Tai Chi, helps keep joints flexible, supports heart health, and can improve sleep quality without the need for a nighttime sedative. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats supplies the nutrients that many pills try to replace. Staying well hydrated, limiting alcohol, and quitting smoking are simple actions that can lower blood pressure and reduce the reliance on diuretics or blood pressure blockers. Third, be vigilant for warning signals. If you notice unexplained bruising, persistent stomach discomfort, sudden dizziness, memory lapses, muscle weakness, or a change in the color of your your urine, write it down and bring it to your next appointment. These clues are your body's way of saying something isn't right. Fourth, consider non-pharmacological alternatives when they are appropriate. For heartburn, elevating the head of the bed, eating smaller meals, and avoiding spicy foods can often replace the need for long-term acid suppressors. For occasional insomnia, a warm bath, a cup of herbal tea, or a short meditation routine may be enough to help you drift off without a sleep pill. For mild anxiety or low mood, staying socially active, engaging in hobbies, and spending time outdoors have proven benefits that sometimes outweigh the need for antidepressants. And finally, keep a personal health journal. Write down each medication, the dose, the time you take it, and any side effects you experience. Over weeks and months, you will start to see patterns. Maybe the joint pain flares after a certain painkiller, or the morning fog appears after a sleep aid. Seeing these patterns makes it easier to discuss concrete concerns with your doctor, who can then tailor a plan that respects both your health goals and your desire for independence. Let me share a brief story that illustrates the power of this approach. Antonio, a 74-year-old retired carpenter, loved working in his workshop every morning. He began taking a pain reliever for his arthritic hands and a sleep aid to help him rest after long days. Within a few months, he found himself forgetting the tools he needed, tripping over his own footstool, and feeling unusually tired even after a full night's sleep. He thought it was just getting older until his granddaughter, a nursing student, suggested they write down everything he was taking. When they reviewed the list together, they realized the combination of the painkiller and the sleep aid was causing the dizziness and confusion. Antonio's doctor adjusted the pain management plan, introduced a low-impact hand exercise routine, and switched the sleep aid to a non-sedating herbal tea. Within weeks, Antonio regained his steadiness, his memory sharpened, and he was back to crafting wooden toys for his grandchildren. His story shows that a small change, simply paying attention and asking the right questions, can protect the quality of life you cherish. Now, before we finish, I want to leave you with a thought that may feel a little uncomfortable, but it is essential. If you ignore these hidden risks, you may find yourself gradually losing the ability to do the simple things you love. Walking to the mailbox, cooking a favorite meal, playing with grandchildren, or even reading a book without needing to pause for a dizzy spell. Health is the foundation of independence, and independence is priceless. Take a moment right now to look at your medicine cabinet. Ask yourself, do I truly need every pill inside? Am I aware of the possible side effects that could be affecting me right now? If any doubt lingers, pick up the phone and schedule that medication review. You deserve to feel safe, alert, and in control of your own body. Your future self will thank you for the choices you make today. If this conversation opened your eyes, if you feel empowered to take a closer look at what's in your daily routine, please share your thoughts in the comments below. Tell us which medication you've been curious about or a personal experience you've had with any of these drugs. Your story could help someone else who is watching and feeling uncertain. And if you found value in this information, consider subscribing so you won't miss future videos where we dive deeper into practical health tips, safe aging strategies, and ways to keep your mind and body thriving. A simple click can keep you connected to a community that cares about living well at every age. Remember, knowledge is the most powerful medicine you can give yourself. Take care, stay informed, and keep moving forward with confidence.